I am Dr. Heather Moore. I own Total Performance Physical Therapy, and tonight we are going to talk about why does my knee hurt when I go down the steps. This is usually one of the first signs of knee pain, and it is when you're going down the steps, you start to feel a twinge. Doesn't stop you from going down the steps, doesn't really even debilitate you, but you'll feel a little bit of pain either in the front, side, or the back of the knee. This is a really big indication that there's something going on at your knee. So you want to pay attention to this because this is kind of the first warning sign that things are about to get worse. And again, it doesn't debilitate you, it doesn't stop you from going down, but you may get, and it may not happen every time. You may go down a curb or a couple steps and feel pretty good. And then, you might start to go down more often and it might start to bother you. Some people actually turn to the side and go down. Some people maybe turn their feet out and go down. But why does this start to happen? And why when you're going down the steps? A lot of people will report pain going down the steps before they feel pain going up the steps. That is in the difference in the muscle control that it takes to go down the steps as opposed to that it takes to go up the steps. It's a different type of muscle control, and we'll touch on that a little bit. But it's more important to understand why it is starting to hurt when you go down the steps and the importance of why that is such a big indication of something going on at your knee. So I'm going to give you one of my special drawings. Again, physical therapist, not an artist, so bear with me. But here's your knee. Here's your leg. Here's your little kneecap. And here's the bottom of your leg, and here's your foot. Okay? Knee pain in and of itself. So if you're walking down the steps and you feel knee pain, it's not coming from your knee. There's nothing happening at your knee. Okay? And this is what makes it so difficult. And a lot of even medical professionals will miss this diagnosis because, oh, you have knee pain, it's got to be coming from your knee. We got to find something at your knee. And most of the often, if you get like an MRI or an X-ray, it's going to show some arthritis. And it's going to be like, oh, you just have arthritis at your knee, but it's not bad enough to get the knee replacement. Suffer through it, deal with it. We'll do a couple of like longer quads or something along those lines. You'll be fine, whatever. You feel defeated because 3 months later you still have knee pain. And you're like, oh, it's arthritis. I can't do anything about it. It's not arthritis, and you can do something about it. So here's your knee, here's your kneecap, here's your thigh, here's your lower leg, and here's your foot. What happens at the knee is all the muscles here come up and attach at the knee. And all the muscles at the foot come up and attach at the knee. Okay, so the knee is really the hub of all of this activity. All right, so it's got the foot pulling on these muscles, which is pulling on the knee. It's got your hip, your back, okay, pulling on the knee. So everything is really pulling in different directions on the knee. Nothing really attaches at the knee or belongs solely to the knee. I misspoke. Things attach to the knee, but they don't belong solely to the knee. They're called, but we have two joint muscles. They usually will control your hip and your knee, or your knee and your ankle, something along those lines. Like your quadricep, okay? Group of muscles in the front of your leg, they control part of your hip and your knee, okay? So the prime mover of your knee, one of the ones that actually extends your legs out, actually also helps to move your hip. So that's what I mean by this knee is a hub for a lot of activity. So let's address the point of arthritis. So a lot of times you have your kneecap, which looks something not like that at all probably. But what happens is over time, underneath the kneecap, it's got a little mountain range on there. It's not smooth. So as you age, yes, we all do, you will wind up wearing away some of that cartilage underneath that kneecap. And what will happen is that will create the arthritis, okay? That will allow the arthritis to show on the MRI or the X-ray. That doesn't mean that's where your knee pain is coming from. Unless someone's saying to you, you know what, it's time for a knee replacement, arthritis is not causing your pain. So that's where the arthritis is coming from. It's just this bony surface, which is your kneecap. The back of it starts to wear away over time. You can't help it. It's going to happen. Every time you bend and straighten your knee, you're going to wear a little bit more of it away until it's finally evident on X-ray and MRI. Inside your actual knee, you have some meniscus. Now, some people out there might have had a meniscus tear or two. That's a problem at your knee. That's pain coming from your knee, okay? A lot of times you're going to get a meniscus tear when you plant your foot and you turn, okay? We see it a lot in sports, skiing, things like that. For the older adult population who are weekend warriors, you know, if you're playing football, you plant and you turn, that's where you're going to get a meniscus tear. That's knee pain. If you don't have a reason to get a knee replacement, meaning your arthritis isn't bad enough for a knee replacement, or you don't have a meniscus tear, or you didn't sprain a ligament, you cannot sprain a ligament getting up from your desk in your knee, okay? So if you go from sit to stand, you're not going to sprain a ligament. So you're not going to get pain and go, oh my gosh, I think I just sprained a ligament in my knee, okay? Just doing something like that, or, you know, just gently going down the steps. If you fall down the steps, you're going to sprain a ligament in your knee. But, you know, just doing normal activity, you're not going to sprain a ligament in your knee. So that rules out your ligament, your meniscus, and your bone. Now you got muscles. Well, all the muscles in your knee come from your hip and your foot. So what happens at your knee when you go down the steps, and I'm going to show you in a very exaggerated form, is if you don't have strong hip muscles, okay, and your feet are not aligned correctly. Let's say you're walking down the stairs barefoot, okay, and you have flat feet. What's going to happen is your knee is going to start to go in. And again, this is a really gross exaggeration of exactly what happens as you go down those steps. But this, if you take your time and you look, now a lot of times what will happen is people take their time and look, and then they'll correct for what they're actually looking for. But your knee will cave in, okay? And what's going to happen is this unnatural movement in is going to cause the pain. So you're putting strain on muscles here, here in the front of your leg. You're compressing your patella. You're compressing that bone. That's what's causing the pain. You get muscle weakness in your hip, which most people have. All right, most people do not have the hip strength that does not allow their legs to cave in. Okay, combine that with something going on the foot. Maybe you have flat feet. Maybe you have an overarch. Those types of things are going to aggravate your knee as they go down the steps. So if you go to a doctor or physical therapist and all they're doing is working on your knee, it's all wrong because there's nothing happening at your knee. What's happening is you're having a failure of your hip and you're having a failure of your foot. Nothing's happening at the knee. The knee is just kind of the perfect storm of where everything takes place. Okay? So when you go down the steps and you start to feel that pain, and it usually starts off as a twinge as opposed to anything else, that twinge is from your hip. That twinge is from your hip either being tight, maybe being weak, maybe a combination of everything. Okay? So the first thing that you want to do is you want to watch yourself walk down the steps, and you want to see if your knee caves in. Okay? Does your knee go in? Go in. And again, like I said, as you're going down the steps, you might not be able to tell because you're now telling your brain, okay, don't let my knee go in. And you're going to walk down nice and perfectly, and nothing's going to bother you, and it's going to look perfect until you don't remember anymore, and then you're going to start with this. Now, it shows up on the steps first because when you walk, you don't put that much pressure on your knee. You don't need to engage your knee very much when you are walking in terms of using the muscles like you do when you go down the steps. So that's why it shows up going down the steps most often first. It may show up going up the steps too, but most notably it shows up going down the steps. So you want to watch your knee. Are you going in? That is a failure of your hip muscles to control your knee. That's not anything at your knee. There's nothing you're going to do at your knee. None of this, okay? You can do leg extensions all day long. It's not going to help. You want to strengthen your hip. So after you determine if your knee is going in, okay, what you're going to do is you're going to do some hip hikes. Very, very small movement, very, very big results, okay? So all you're going to do is you're going to stand on your one leg. You're going to make your leg almost straight, but not quite. And then you're just going to drop your hip and bring it up. Nice and easy. Okay? Yes, this works balance, and it also works your hip. If you're doing this, you're doing it wrong. If you're getting pain in your knee, you're doing it wrong. It means this leg is moving or this leg is locked out. You want it slightly unlocked, and then you're going to drop it down and bring it up. Drop it down, bring it up, okay? You're going to feel the burn on the outside of the leg. That's where you want to feel the burn, okay? The second thing you're going to do is foam roll. And how do you foam roll? You're going to Google Total Performance Physical Therapy. It's too late, I can't even spell. Total Performance Physical Therapy YouTube channel. Okay? There are a ton of videos on our YouTube channel that show you how to foam roll. It is imperative that you get on a consistent foam rolling program if you are having problems walking down the steps, if you have pain walking down the steps. Stretching is not going to do it. So you can stretch all day long, have at it, it's not going to work, okay? Foam roll. And like I said, Total Performance Physical Therapy, go hit subscribe on the YouTube channel, and you can see all of our videos that we have on the foam roller. And there's a lot of them because I am a huge believer in foam rolling. All right, and then the final thing that you're going to do, if you have pain going down the steps, you are going to minimize, and by minimize, I mean eliminate, bare feet. That means flip-flops, that means cute little shoes, that means high heels. You are going to eliminate bare feet. And I tell you why, because the foot controls what goes on at the hip and what goes on at the knee. So if you have those twinges and you're going down the steps and you're going down in bare feet, you're not helping yourself. And I understand right now you're going to get away with it. And you're going to be like, I am not giving up my flip-flops, my bare feet, or my high heels. Great. I'll see you in 2 months. Okay? That is what you can do to help control your knee for right now. It's what your knee needs while you're doing your hip hikes, while you're doing your foam rolling, and you're incorporating that into your daily routine. You need to give your foot and your knee some extra support. Sneakers are going to do that. Flats are not going to do that. Flip-flops, I don't care how designer they are, if with arch support and this and that and the other thing, if you don't have knee pain, wear flip-flops all day long. If you don't have foot pain, go ahead. Okay? But when you are suffering or you are starting the very big warning signs that your knee is going to have a lot of problems, you want to take your footwear out of the equation. And I mean wear sneakers. Wear sneakers that are fit to your foot. Okay? So 3 things you're going to do when you have knee pain going down the steps, because that is the first warning sign something's going on with your knee. Get it while it's hurting, only going down the steps and only twinging every once in a while before it becomes a huge problem. So you're going to, 1, do your hip hikes, okay? You can do about a minute on each side 3 times. Nice and slow, all the way down, all the way up, okay? Then you're going to Google our Total Performance Physical Therapy YouTube channel, subscribe to it, and watch our videos on foam rolling. Foam roll your entire leg, front, side, back, all of it. It's all on there, and you need to be doing it, okay? Finally, you're going to watch your footwear. No high heels, no flip-flops, no bare feet until you go walk down those steps without changing how you walk and without there being pain. Then you can slowly start to wear your high heels, flip-flops, and bare feet again.